According to Uganda AIDS Commission, the HIV prevalence is currently at 5.1%, and in the 2022 report, the HIV new infections were 52,000, with 35% of the new infections being among young people between 15 and 25 years. Edith Nabalanyi, a medical practitioner, says they have discovered that many people in Kisamula Village, Mpigi District, are HIV positive according to the results that have been received during the health camp that was organized by the health workers from the area with support from politicians that included HIV testing, malaria, hypertension, diarrhea and testing of other diseases.
Ebidukano, ebifuba, ebisenyiga n'emisujja. Then abakulu tusinze kusanga nti abasinga balwadde bakawuka. Abalwadde bakawuka ng'oli akayina nga tukyayinamu ne category egamba nti nze mbadde simanyi nti ndi mulwadde wabula nga yagenda ne ku basawo ng'alowooza bamuroga.
The high rate of HIV infections was attributed to lack of adequate awareness campaigns about avoiding to get infected with HIV, saying that according to the information they have, some people who are HIV positive were on ARVs but later abandoned them, hence putting their life in danger.
Abamu badde interview nga ne baŋŋamba nti musawo nze soogedde nti nalivaako naye nze nalivaako ku lw'embeera y'okutambula okunoonya eddagala. Nti singa tuba tusobola okufuna obuyambi nti n'abataso ne batuyamba ne tufuna eddagala kiriniki kwe tuteeka eddagala nti abantu baffe basobola okufunirawo eddagala mu kitundu nti ebyalo ebituliraanye nga bisobola okuyambibwa ne bifuna ne tubeera nga omuntu asobola okutambulawo ng'agenda kima eddagala.
Nabalanyi further reveals that the increase of other diseases in the area is due to poverty because many people can't afford private hospitals or transport to government health facilities.
Tuura naddala nze omusawo w'oku kyalo nti abalwadde be tuyina ekyalo kyaffe kinene naye abalwadde bangi nga n'ebirwadde bye bayina nze nga sibisobola nga binsukkako naye ate nga tuyina okuyamba. Naye ng'omulwadde bw'omugamba nti gendako mu ddwaliro eddene ng'akugamba sirina transport nga ekizibu ky'obwavu nga kireetera omulwadde okuba omuyi ne batuuka okumutwala mu ddwaliro nga takyategeerekeka. So kwe kutuula nze nganze ne ndowooza nti singa nnoonya abasawo abakolera mu Kisamula muno mu kitundu kino ekyaffe.
Dr. Fiona Mutesi, Medical Services Coordinator under TASO Uganda in Mulago, explained that the barriers they get with HIV patients are that the clients abandon medication, though TASO makes a follow-up to ensure they remain on drugs.
Tuddamu ne tumukebera sikawuka wabula zino endwadde endala zenjogeddeko ne tulaba nti buli kimu kitambula bulungi ne tulyoka tumuzza ku ddagala. Era bwe tumuzza ku ddagala tumubudaabuda tuyogerezeganya naye ne tulaba nti ensonga ezamuviirako okumissinga appointment tuzikubaganya.
Dr. Mutesi also highlighted that as TASO they recommend starting immediate treatment to those that have tested positive.
If someone turns positive, we will first of all evaluate if they are able, if they are ready to start treatment. Whether ready or not, we do our best to communicate to this person to understand the importance of starting HIV treatment as soon as possible and the dangers of not starting treatment. And so many of the times they will be convinced well enough to start treatment.
She also highlighted the dangers of not starting treatment when someone tests positive, such as multiplication of the virus, hence weakening the body immunity.
If that kind of person who feels okay does not start treatment, the virus will continue to multiply. And as the virus continues to multiply, it continues to weaken the body's immune system. And as the body's immune system continues to weaken, it results in them getting what we call the opportunistic infections, which are diseases that ideally they would not have contracted if the immune system was strong enough, like for a normal person.
Joseph Matovu, chief organizer of the community health camp, also explained why they have decided to organize the community health camp in Kisamula Village, especially to promote HIV awareness.
Its purpose is purposely to help the community get awareness about the good health services to the community, and also to raise awareness for their continuous prevention against their lives, against a number of diseases.
Matovu said that they are to follow up together with TASO on the people who have tested positive to ensure that they go for medication.
We have TASO on ground. This is going to be done, and many are going to be referred, and the follow-up will be done on these patients so that they can start taking their drugs. So this is going to be an ongoing program that whenever they will come to the community, they identify the patients, they will always start medication straight away.
They want the government to ensure availability of health services in the area.
The government should finance the local leaders within our communities to make sure they run up these programs. The L1 chairman and its leaders take a key role to understand the residents within their communities. So we really encourage the government to stop spending a lot of money in hotels. Let them bring the funding and assistance to these local communities.
Story compiled by Julius Muhumuza for News at 8.